All right, Coach. I know we talked a little bit before, but like, can you introduce yourself for the audience and kind of explain your role with the team right now?
Yeah, absolutely. So my name is Willey, and I work with the University of North Carolina with the football team. For the past 2 seasons, primarily my role has been with the return to play side of things, and I was hired on from more of the strength and conditioning side to help out with the management of this because typically in a college setting, athletic training will be the ones that are responsible for managing a lot of the rehabilitation. And there's a lot of great clinicians that are athletic trainers, but it kind of does them a disservice and puts them in a weird spot because you're asking a few people to manage 120 players who need a lot of pregame ankle taping, wrist taping, splinting of all kinds of different things placed on, and then you're asking them to set up the field with water, with medical kits, with AEDs, everything pregame and pre-practice, and then also to deal with any acute injuries that may happen on field as well as immediately post practice, getting some maybe more passive modality type care. And so it's really not fair to them to ask them to also do rehabilitation of long term related athletes, whether it's surgical management, and now we're doing rehabilitation, or even just some of these more long standing chronic issues. And so I was brought on to kind of help manage some of that return to play process and marry the two fields between what was happening on the healthcare and medical side and what was happening on the performance and strength and conditioning side, and kind of find a way to balance people back in to create a seamless transition of, oh, well, you've passed the surgeon's protocols, but that doesn't mean that you're ready to actually step on the field and play. But what's the bridge between the two? And that was where I came in, where, okay, now we've made it through the more very basic rudimentary rehab and typical really simple range of motion related stuff. Now, what do I do from here? And that's where I came in and operate.
Nice, nice, nice. So, I've been following your Instagram for probably a long time. I can't remember when I started following, and you post a lot of great stuff. But before we t kind of talk about this, the main topic we want to talk about today. So, as a PT or as a physical therapist, what got you into like sprinting?
So I was an athlete all through ever since I can remember. When I was a little kid, I played every sport I possibly could. It never stopped, and which was odd because my parents were not athletes and didn't understand why I wanted to do sport, but I did everything. Like everything from boxing to hockey to soccer to baseball to football to lacrosse. It just, if I could do it and it was available and there was a team, chances are I did it. And I also really enjoyed working alongside, being a part of a team setting, but also like I was really interested in physical culture ever since I was a little kid. And I remember being like 6, 7, 8 years old and just sitting in front of the TV watching cartoons, but I was doing sit-ups and squats and push-ups, and I would go for runs. Like even when I was a really little kid, I just would do like planned running. In addition to all the playing that I did, it was like I got really obsessed with training. And the way I describe it is, if anyone has ever seen the movie Eddie the Eagle and how the actor is depicted in that movie just doing random physical feats in hopes that one day he could like make it to the Olympics doing something. That was kind of like me as a kid, just doing like a lot of stuff and getting into a lot of trouble trying to push, physical boundaries. And so that just kind of stuck with me. And um, after I had finished playing lacrosse at University of North Carolina, I pursued other things that were more closely related to sprinting, like USA bobsled. So I was a USA bobsled athlete for a season prior to then taking the job at UNC, working with football, and that's really where I think the obsession with sprint training came into play, and got to work with some really great coaches, including Les Spellman, who I learned a lot from, and just I think ever since then, it just became one of these things that, even though I wasn't traditionally brought up in that way and was more based on the sport skills itself, sprinting now, as I've become older and further removed from team sport, it's like one of those things that like I'm grasping onto for dear life, that I could still be athletic if I just sprint fast. So
I
uh,
feel that. I feel that.
yeah, and it just seems to be one of these things that in sport, the same way that I wasn't really exposed to a lot of very high level sprint training in playing sport, I feel like you kind of have to do track if you want to get exposed to high level sprint training. And I always thought that was odd because sprinting is such a huge piece of a lot of field and court sports that I felt that we should take some of what is happening in the track world and from great track coaches and applying it to things like rugby and soccer and football and lacrosse and I think there'd be a lot of benefit. So, anyways, that's kind of where the obsession, I guess, can continues to carry on.
Nice, nice. I'm glad that you brought up like Les Spellman, because before I came to Louisville, when I was in town, I actually followed like every video or like every content he posts, and he put up a lot of great work. I actually like him a lot. So, and also I came from a trap background, so like after I moved from Taiwan to the state, I was actually shocked that because Les Spellman has a pretty impactful in Asia. It's pretty impactful in Asia.
Hmm.
So I thought like in the state, probably a lot of teams for are already familiar with like the basic like sprinting mechanics, all those acceleration, max velocity. But after I moved here, I was kind of shocked that like the some type of like basic sprinting mechanics, a lot of like strength coaches or like uh yeah, performance coaches are not that familiar with those stuff.
Yeah, absolutely. I think you're spot on. And one of the things that I thought was crazy, I went to the CSCCA conference, which is basically the college strength coaches conference. And I remember walking out of one of the meeting halls and literally hearing a group of strength coaches behind me talking about how they don't believe in and don't see the point of training max velocity. And that their point and everything they were talking about, because I was like eavesdropping at that point because I was so alarmed that like I couldn't tell if they were sarcastic or not, and they were dead serious, was that like in sport, you never get above 70% or 75% of your max velocity. So why are we even touching it or even training it? We need to, spend all this time in acceleration and all this time in 70 to 80%, of max V, just training accels and decels. And like, you're so right. You would think that these concepts are universally accepted because there's so much evidence and research behind it. And yet we still have very strong opinions in the strength and conditioning and performance world that are actively working with athletes that are doing them a significant disservice
Yep.
because they have these very outdated and misguided beliefs.
Yeah, yeah, I agree with you. So that's so that lead me to the main thing, the main topic I want to like talk to you about today is like I think it's a few months ago, Coach Boo, one of my mentor, Coach Boo, kind of like tweeted this like he said Nordic hamstring curl is actually not the cure, but the poison for hamstring injury. So before we dive into like what Nordic curls do, in your experience, like typically when does hamstring strain occur and like when and in what situation?
Yeah. So yeah, we can circle back to that tweet from Bushexnator, which, I mean, massive respect to him as a coach. He's done incredible things across the field of track and field and sprint training, and I really have a high regard and respect, even though I may pose some disagreements with that statement. But I think so with hamstring injury in general, we see that hamstring injuries account for about 10% of injuries in team-based field sport. That's a ton. Like if you think about all the possible injuries and aches and pains and things that can arise in across all team sports, for 10% of those to be hamstrings, that's a pretty massive chunk that you're going to be seeing. So for anyone listening, whether you're a coach or a physical therapist or an athletic trainer, chiropractor, you name it, if you work with athletes, there's probably a pretty high chance that you're going to be working with somebody that has a hamstring related injury. So, pay attention is what I'm saying. And we also know that beyond that, that re-injury rates of hamstrings are very high. Upwards of like somewhere between, I think on the very low end, it's like very optimistic at like 13 or 14%. But on the higher end, we're up to like 63 or 64%, which is crazy. More than half are getting re-injured. So again, not only are you going to see someone that has an initial onset of injury, but the chances of seeing someone who previously had a hamstring injury and are now dealing with it again, or even more of a chronic kind of ongoing where it always feels a little bit tight or always feels a little bit off, you're going to be probably exposed to that. And where we see this happen is in sprint mechanics research and biomechanics, and when they do like force testing on the hamstring, where they put these little strain inducer or transducers in the hamstring, um, what we see is that there's a point during the swing phase where the heel is coming to the butt and you're starting to pull the leg through. So the hip is now coming into flexion out in front of the body while the leg is still bent. When the leg is bent and being brought up to, like, imagine your calf coming in contact with the hamstring on the backside of your leg, when that motion is occurring as the leg is swinging through, there's a large amount of energy absorption happening through the hamstring group, that posterior chain, because it just applied a lot of force. It got this great, like, stretch shortening cycle that happened. But once it leaves the ground and is now pulling back and recycling for the next stride, you actually have a large peak in force absorption in that phase. But then on the back end of that force absorption, now when the leg extends out and you're starting to extend the knee prior to meeting the ground on the next contact, you get this overlap, this crossing of where there was a high amount of force absorption. And now you have a rapid extensor kind of mechanism happening in that hamstring. So you get a rapid lengthening while force is being absorbed, and you also get some pretension happening in preparation or in yeah, I guess you could just say in preparation for meeting the ground, as well as, you may start to bring that foot back underneath you if you're practicing those good sprint mechanics. It's already starting to accelerate towards the ground as you're finishing that knee extension, and so you get this massive crossover of forces, and that's typically where we see this happen. Now it does happen in deceleration as well for a lot of the same reasons. Imagine coming into a really hard, just straight on deceleration. Typically, you'll see someone's trunk lean forward because that's their center of mass on their shoulders. Their momentum is still traveling forward and they're trying to stop that. So you have a massive amount of trunk flexion, which is going to put a little bit of pre-stretch on that hamstring anyways, kind of similar to like what you would imagine in an RDL, Romanian deadlift type position, or a hip hinge. And then you also have extension of the knee as you're coming into those steps, those penultimate steps, stopping you or getting ready to take off to jump. If we're talking about something like a volleyball hit or a dunk, you have a reaching step after that, which is that penultimate step that you can see hamstring injuries happen in that. And maybe the third one is just a rapid change of direction as well. That can happen in something like a 90, a 45, or 180-degree cut for a lot of the same reasons that we talked about with linear decels, is that you just have a large amount of trunk variation that can occur, whether that's rotation or that's side bending or flexion and extension in the trunk. And then you also have rapid extending of the knee and forces going through the hamstring as well. It's just a little bit more rare to see those things. And I would say that, predominantly in sports like football that I work with, we see these happen in more of the sprinting, as well as very, very subtle changes of direction while sprinting, like a slight curve or just one step where they had to make a slight adjustment to their left or their right side at a pretty high velocity that's just putting a little bit of extra strain on that hamstring. That's typically where you're going to see some of these things pop up.
Nice, nice. So, um, since you work for football, like I came from a track background,
Mhm.
so I'll probably start with this. Why does everybody focus on like hamstring eccentric strength, tempo, instead of like sprinting mechanics, acceleration mechanics, or the speed of the speed of muscle contraction?
Mhm. So, yeah, I think that, and maybe we'll get into a little bit of what Boo was trying to convey in his message. I think a lot of folks get really into this eccentric strength component because of maybe some early research that was done with Nordic hamstring curls and some promise that showed that it may reduce the risk of hamstring strain. And so everybody kind of jumped on this and said, "Oh, this is going to be this magic exercise. It's going to fix this thing." And lo and behold, here we are, almost a decade later after some of that initial hype came, and we haven't really made as much of a dent in hamstring related rehabilitation as well as initial injury onset, despite some of these things, being employed. And, and I will say that programs like the FIFA 11 that was done in mostly Premier Soccer, and you see this happen in like European football. That type of program has been fairly successful in reducing hamstring as well as groin related injuries. And I don't think that it's necessarily that there's anything magic, particularly about something like a Nordic hamstring curl or a Copenhagen plank raise. It's just that they're doing some level of programmed strength training somewhat regularly. And I think there's probably a chronic response to the strengthening, the load that happens over time with them. But I don't think that you're going to be doing, a large amount of Nordics and all of a sudden just mitigate all of your risk. And no amount of you just doing weight room things is going to prepare you to do field related things and sprinting. And I think that we should step out of this zone of just thinking about the hamstring. And we were kind of talking before we got on the call that the hamstring is not a wildly different structure or muscle than any other muscle or structure in our body. It's adaptable, and I think we kind of mentioned, people talk about the spine as if it's this like, weird enigma thing inside of us that we have to treat so fragile and delicately, and we can't flex or extend it or side bend. And heaven forbid if a disc, herniates, and it's like, no, we have pretty damn good research that these things heal really well, and we're pretty adaptable to load, and the hamstring is no different. So I would say that he used the word poison, and I think really like the dose probably makes the poison more so than the exercise itself being the poison. But I think there's a balance, right, with everything. We can't expect, and where, before I forget where I was actually going with some of that talk about tissues and how the hamstring isn't different, is that we wouldn't expect to only train a back squat and massively change a vertical jump or your ability to dunk. If you can't dunk, and then all of a sudden you just did a, let's say 8 week back squat program and you didn't touch dunking for those 8 weeks, and then you went to dunk again, well, one, you're going to feel very uncoordinated, but you're probably going to develop some pretty significant, maybe tendon pain because of the acute, like, abruptness of how much volume you're likely to do on that first day back, because you're so hungry to dunk after all of these squats. But like, we just wouldn't expect that weight room thing to perfectly transfer in a very linear fashion. And so it would be no different in hamstring, that you're not just going to do all kinds of strengthening for the hamstring and all of a sudden, run a sub 11 100-meter dash that or a sub 4 like that. That's just not going to happen. And so there does have to be a little bit of both. However, and this is the big however, and we can get a little bit more to this, and that is that from a lot of data, even though Nordic hamstring curl may have been overblown early on, and some of the effect sizes were maybe a little bit overblown, we still know that of the risk factors that exist with hamstring, being previous injury as the highest one, age, and strength of the hamstring, those are some of your highest risk factors. One of those is pretty modifiable, and that's strength. So if we're talking about the things that mitigate risk, we still know that it's important, right? Working on your mechanics of sprinting and being exposed to sprinting often is clearly going to have a massive positive effect and probably one of the greatest effects. But we can't neglect that something that seems to equate risk across a lifespan with increasing age as well as previous hamstring injury is that when we do see studies that measure eccentric strength as well as just concentric strength on something like a dynamometer, we see that those with the highest strength outputs on their hamstring tend to have the same amount of risk as their younger counterparts or those who have not previously injured a hamstring. And I don't think that we can just totally throw that away because I do think that strength and developing eccentric strength and fascicle length of the hamstring through resistance training is an integral, important piece of the puzzle, but it can't be your only piece, and the dose makes the poison.
Nice, nice. I like it because I remember that when I saw Coach Wu tweeted that, like a lot of like strength coach gone crazy about that. Like
Mm.
literally go crazy. And I was like, because I'm pretty close to Coach Wu. So if you kind of know his program well, you know you'll know that he'll strength like he want his athlete to be strong enough, and he'll probably put like hamstring strength into his program at like a certain degree, not like overdo it. So I agree with you. It's not like the exercise, it's how much people are doing it. Because I I work with different sports and I like work with different like strength coaches. Sometimes you'll see the strength coaches like for injury, all they do is just Nordic hamstring curl. They do it like every week, like 3 sets of 12. I'm like, what the fuck?
Yeah, or even better, you see coaches and I would even say more on the athletic training side or even physical therapy side, you see them doing like BFR hamstring curls for every session 2 or 3 times a week, which is also doing a massive disservice to
Yeah,
the
yeah. I was
folks.
like, oh no, no. But and I also like what you mentioned that sprinting all year long and helping them cleaning their mechanics like all year long, that definitely helps. So can you kind of like before we dive into like how you help your athlete return to play from hamstring strain or like hamstring tear, can you kind of like uh give us like maybe a clue about like how can you categorize like hamstring strain and like hamstring tear?
Hmm. Yeah, absolutely. And yeah, but before we move into that, just to hammer on something Boo also has recently said was talking about overtraining and talking about it's overtraining does exist, but it's probably more like under preparation and under hydration, under sleep, a lot of these other factors that will contribute. And so as we talk about a lot of this stuff, um, you could make the same argument that you could sprint too much and develop some kind of an under preparation, related injury. So it doesn't have to just be a strength training thing that could be hurting you. It could also be just doing more than you're prepared for or adapted to in that time period, and that's a part of this whole discussion as well. Now, when we talk about hamstring strains versus hamstring tears and how to grade these things, the British Athletics Association, I think they put out a paper not too long ago, and there's from 0 up to 4, and there's even some subsections of 2A and 2B and 3A 3B, and I think the grading can be somewhat helpful in just giving kind of a perspective on the extent of damage. But what's interesting is that MRI does a very, very poor job at actually predictively being associated with the return to play time. And so when we talk about grading, it doesn't much the grade unless it's like we're talking about a 0 or a 4. But everything in between has a pretty similar standard deviations overlap quite a bit as far as return to play time. So like here's a funny little example from current literature. We can be 95% confident that the athlete will return to play between 8 and 47 days. That's a big that's a big span of days. There's a big difference between 8 days and 47, and
Yeah.
yet that's the current diagnostic literature in using things like ultrasound and using things like MRI. That's about how accurate and confident we can be and how quickly someone will actually return to play based on the current literature. Now, I think you can get a lot better with that by more frequent testing, especially over the first 7 days. There was a really nice paper that was published by Phil Jacobson and his colleagues that was talking about a combination of tests that you can use within the first week, within the first 7 days. And what's awesome is they actually provided a calculator that's free to use and online, and you can basically plug in some of these test measures and their outcomes over the first 7 days, and you will have a much more accurate picture of how quickly that athlete will likely return to play based on that first 7 days of rehabilitation. But I think to answer your question, the big thing here is, people talk about like, oh, it was only a grade one, it was only a grade two. Like, thank goodness it wasn't a grade three. And it's like, it doesn't actually seem to matter all that much. And I know that like that sounds kind of flippant and maybe dismissive. And I don't mean to be dismissive. I just mean to say that what we have as far as data and the grading of these things probably doesn't matter. And a lot of people will talk about, oh, was it in the muscle belly or was it near the tendon? Well, the funny thing is people will grab really high up, middle of the hamstring or maybe, 2/3 of the way up their leg, let's say, and they're like, oh, but it's up here. So good thing it's not the tendon, right? Well, what's funny is that the long head of the biceps and where the long head of the biceps and the short head of the biceps tendon meet together, that tendon climbs up at least about 2/3 up the posterior thigh. It's a very long tendon that you have this intramuscular tendon that travels up the belly of the hamstring. And so, almost, I'd say, I think we do have some data on this as well that the large majority of hamstring strains, whether it's a grade one or two or three, does happen at the musculotendinous junction. You can almost bet on it. And the reason why is because you have a difference in the type of stiffness between a tendon and a muscle. And we learn this in like from architecture, and you'll see this happen in like bridge. If you're driving over, or excuse me, if you're driving under like an overpass, and you see the cement and the rebar that's going across, and a lot of times you'll see that bridges that have existed for a long period of time and haven't been worked on, the rebar is starting to become exposed, and there's different vibrational frequency between the two materials of cement and metal. Metal is great at being able to handle vibrational loads and more like torsion type loads, and cement is really good at handling compression. But so they're strong in their own different ways. But the place where those two materials meet together usually creates where there's going to be a little bit more damage, so that cement will start breaking apart sooner in the areas that's right up against the rebar. We see this happen in things like why knee replacements or joint replacements, hip replacements, things like that need to be replaced and they don't last forever, is because there's a different stiffness between the new titanium that's placed into someone's hip and the bone that it rests up against. And one will always corrode against the other. And so over a period of time, more bone has to be shaved in or shaved down, and we have to replace the actual metal structure and dig a bigger hole inside the bone where the pin went down in through the femur, for example, because it's starting to basically bore out a larger hole because over time there are differences in the stiffness. And so you have this thing that's very elastic and very stiff in nature, very quick to recoil in tendon, and you have a muscle that's a little bit more soft and pliable and giving. And where those two things meet, it's actually really interesting. It's kind of like you learn in your basic sciences even early on. So I hope people that even aren't like super into histological nature of these things can even understand this. And I think you will. In the gut, like in your large intestine and your stomach, you have all these little folds. And it's like these up and down little ridges. When you look on like an electron microscope, you see all these little folds up and down, up and down, up and down. And that's what gives the actual stomach, or the maybe more accurately, the intestines, more surface area, because you've just packed in all these little folds, right? And so that's what happens in a musculotendinous junction as well. We see all these little folds that the muscle and the tendon are being connected. So you get a lot of surface area between a muscle and a tendon, and you need all that surface area and all that residual, or I should say redundant connection between the two, because it is kind of a weak point between these two different stiffnesses. And that's how our body has basically, figured out how to make that a little bit more resilient. And you'll start to see almost kind of like, Velcro, I guess you could say, kind of peel away at little parts, or it gets a little bit disrupted in some of those areas of the fold, and that is the musculotendinous junction related injury that we had mentioned when it comes to like grading of these things. So hopefully that was informative and helpful.
Yeah, that's awesome. I like the metaphor you did. That was awesome. That was awesome. Uh, so now I kind of want to like dive into like your return to play protocol from like hamstring strain. Like, do you use benchmark or do you use timeline? And like, when do you have them start like doing, or do you have them like do strength first, or like plyo, or like speed first? Yeah.
Mhm. Yeah, so to answer your first part of the question, between using timeline versus benchmark and measurements, I think across the board, regardless of what injury you're working with, using some kind of criteria or a benchmark is going to far and away be your best plan. And we're trying to, as a medical community, get away from using timelines. Timelines can create sometimes a poor expectation, and then the athlete or the patient, whoever you're working with, may become very attached to that timeline, and they just assume that when this time has passed, that they'll be good to go, and that may or may not be true. And so, if you're measuring something and have some kind of outcome that you're always having your finger on the pulse of, you'll know how close or how far away from actually being ready to return to play this person is, and it gives you a guideline of how to progress and when to progress and how aggressive you can be. And so I do, I have a hamstring protocol that I've put out that's available for purchase. But on that protocol, it pulls from a couple of different sources. One of those sources being the Aspetar protocol as well. And there's basically what I have on there is a series of tests. So, one of the funny diagnostic tests for a hamstring is taking off the shoe test, where you basically put the heel of one foot inside the instep or the arch of the other and try to take off your shoe. And the leg that's being tried to peel the shoe off of, if you have pain with that motion, it's like almost just as good as MRI, as far as diagnosing that it is in fact a hamstring strain, versus maybe something that you should be ruling out would be more of like a nerve related injury. So if you do things like a neural tension test or yeah, like a slump test to rule out the possibility of a nerve related injury, that's important. But a taking off the shoe test is oddly very specific to hamstring injury, and very good test. And so if that particular test is greater than a 4 out of 10 pain, for people, you're going to be starting kind of in just this phase one. And in phase one, some of the things that we do in there, we still want to do early exposure to movement and motion. I think a lot of hamstring protocols and things that I see people do across the board in organizations is like for the first 48 to 72 hours, like they don't do anything because they're so worried about, oh, we don't want to damage it more, and we just need to let the acute inflammatory phase take its role. And it's like, well, we actually have pretty good research data that early exposure, like within the first 24 hours of hamstring strain, and then even working up to pain thresholds, not pain free rehab, has far better outcomes, or at least equivalent outcomes, and that those people tend to have better strength numbers and tend to stave off injury for longer periods of time after injury. So it's kind of like one of these things where I don't know why we do this and have just kind of widely accepted that, oh, yeah, we need to rest people, because you don't. And I think even just from a psychological perspective, like getting someone who feels that a big chunk of their season or training is lost because of this hamstring injury, if you can get them back on the field doing something, even if that something looks pretty rudimentary or basic early on, that's a huge win for them. Especially when just walking around, like going up and down stairs, is painful for the first couple of days after hamstring injury. If you can get on the field and do something that feels and looks like training, that's a huge mental win for a lot of people. And we know that, like I said, you're probably going to have better long term outcomes and faster return to play if you do that anyway. So it's kind of a win win there. So my goal is what can you do? And if it's just something simple, like we'll start with just kind of I talk about like staying in the phone booth or staying in like your tunnel, this little tube. Imagine you're standing in this little tube and you can't really go outside of that tube and you can't really reach the leg outside of that tube to start. And we're going to do a lot of things in this tunnel, very vertical, very up and down oriented. And so like just marching, marching in place, and seeing how high can you lift your thigh. Okay, you can only lift it to there to start, and you'll see them wince and pain and have this like look of maybe frustration or whatever when they first start. And then what you'll see is as you have them go through a couple of sets of marching, and maybe you've been out on the field for 10-15 minutes kind of going through some of these motions, even if it's like some really simple basic isometric type stuff and really easy positions, you'll see their symptoms really start to improve, and that range of motion will improve and they'll be shocked. And it's one of those really nice moments that you get some easy buy-in with people where you kind of had an expectation violation, right? They expected something to happen and be one way, and you just now did something that really overturned that expectation and made them feel more positive about their situation, which is a massive thing as a clinician that you're always trying to do, whether you're a coach, a clinician, an athletic trainer, whoever you are, whoever you're working with. You want to instill positivity and resilience and anti-fragility and self-efficacy into these people. And that's just a really simple way to do that, is very early exposure. And so now to get into some of the specifics about what you asked, we will do some of like the Carl Askling hamstring lengthening protocol type stuff, where we may do the Askling extenders. That's where you're lying on your back and you pull your knee towards your chest with the leg bent, the knee bent, and you're just pulling your thigh in towards your belly. And then you're trying to, from that position, lightly extend your knee without letting your thigh escape from your chest or your belly, right? And their range of motion to start on that will probably be pretty poor, and that's okay. You're just working with what they have for that first, couple of days there. And if you expose them to it early, you see a pretty rapid turnaround in that type of thing. So we'll do that. We may do some really basic, slow, straight leg raises. We may do some isometrics. Some easy ways to start would be putting the athlete's heels up on an elevated surface so that more of their body weight is going through their shoulders if they're laying on their back, and just having them dig their heel into the bench or the plyo box. And you could even go both legs on and see if they can just start engaging the hamstring on their affected side with the help of their unaffected side. And just getting them used to like, yep, this is what tension feels in my hamstring. Yep, you can actually engage it. Yep, your body can interact with this and start sending neurological signals to an area that it previously wanted to shut down. And that will also help them start to really like coordinate the neuromuscular patterns that's needed to get back into the sprinting if you do that early and start building some of those early neuromuscular connections, or at least preserving them, versus letting the muscle go to waste and then having to climb out of a hole 2 or 3 weeks later after the hamstring injury has occurred. So yes, there are some very basic strength and conditioning, just kind of basic isometrics, basic tension type stuff that we're working on early on, and then doing some marching related stuff and some basic, really easy movements on the field. And the biggest thing too is similar to any injury, like we were going to talk about ACL potentially during this call, and we won't. But you know, the key is to also keep all of the other qualities of this athlete really, really high. So it was somebody with a hamstring injury. You still have to maintain a high level of cardiovascular fitness. Can you do that on a bike where, maybe you set the seat at a height where it's a little lower, so they're not having to extend out, but not so low that they're going into so much hip flexion, and slide the seat forward a lot so they're right over the top of their feet. Okay, great. Yeah, it's not ideal, but I could do that. You could even get on an assault bike and just use the handles and keep the feet still. You could use a ski ergometer type thing, and do that. Can you do something? And then all the other lifting stuff, you still got a whole other limb and a core and an upper body to train. What things and how creative can you be in getting really freaking strong in all these other areas while you're not practicing. You're down on your confidence and you're wanting to get back so bad. Okay, great. Let's make things really, really, really intense on the areas that don't hurt, and let's maximize your fitness in every other category while we wait for this hamstring to come up to speed. And I think that's just another aspect that maybe is often forgotten because we get so myopic on treating just the hamstring.
Nice, nice. I I love it, and I'm gonna say I'm totally agree with you, because I'm 32 right now. So it's a few years ago, like after I graduated from college, I haven't been like really sprinting for a long time. And then like I started to sprint, and then all of a sudden like tear my hamstring. And I went to a PT. He said I need to rest for like 6 weeks. And after that, after 6 weeks, then do a little like strength training. Then after that, I can go back to sprinting.
Mm,
So so the timeline for me to go back to sprinting probably be like after 3 months.
right.
So I was devastated. But at that time, I changed my sprint coach to another like track coach. And what we did, I think it's the first week. It was a little late, but the first week after my hamstring train, it's actually a hamstring tear. But first week after the hamstring tear, we did A skip, we did B skip, we did kind of bounding. I was like, it was kind of like a little bit pain, but not so much. And so I got back to sprinting after 3 weeks, like
Yeah.
all out sprinting just 3 weeks,
Right.
and it was crazy.
Yeah. Isn't that so different? And yeah, unfortunately, these really, really outdated approaches to rehabilitation where we have to treat people like glass and be so careful and so protective. There's instances, right? Like, post surgery, even and it's somebody young and we're trying to protect sutures and whatever the surgeon had sewn together and repaired. Sure, there's moments to protect, there's moments where we need that, but in things like soft tissue injury, muscular injury, tendinous related injury that is not one of these extreme things that requires some kind of higher level medical care, we really don't have to be so protective. And a little bit of symptoms during these things is perfectly fine. And especially in hamstring, we like I said before, Jack Hickey and his group, which is a group in Australia that have worked on a lot of the same papers that you see people like Christian Thorberg and David Opar contributing to, and their group did study on that very piece of evidence of hamstring pain threshold versus pain free in Australian football players, or I think it was either Australian rules football or rugby, one of the two. And yeah, it's like, look, you can get back to playing probably sooner if you push through a little bit of symptoms early on, and obviously we're going to respect it. But like, you can work through some level of tolerable and recoverable symptoms. Um, and still be active and engaged in things that look and feel a little bit like running. Like you said, you were doing skips and some bounding type stuff, and it was a little bit sensitive. But 3 weeks later, you were sprinting. So I think good, good, good on you. That's awesome.
And another thing I want to brought up, and you kind of mentioned that, is in the track world, like we kind of do if the athlete's injured somehow, we kind of like they kind of like to do this circuit thing, no matter it's body weight circuit or like hypertrophy circuit, med ball circuit, to help like with just help building up fitness, help them recover faster, like you mentioned. And I think this is a thing that like nowadays strength coaches kind of like probably if they focus too much on upper metric, kind of like miss this.
Yeah, I think that well, and even to Boo Schexnayder's point, I think there is sometimes an aversion to strength work at all in speed and track related athletes. There's a fear. around strength training will, make you slow, or, strength training. We don't want to put on muscle because, if you have, too much muscle, then you're going to weigh more, and that'll also make you slow. And I think there's a lot of nuance and way too many factors at play to just make a blanket statement that across the board, weight training equals slow, weight training equals gained weight. You know how many people try to gain weight doing strength training and are unsuccessful?
Yeah.
It's a lot of young males' dream as they enter the gym and start lifting weights that they could start gaining muscle mass and find that it is fairly difficult to do after a little while, and it does take a long time to do that. And so if you have 3 weeks, 4 weeks, 5 weeks, even 6 weeks, a period of time where you're not going to be able to participate in normal practices with sprinting, there's not really going to be a whole lot of harm done in working on some other muscular tension across the board and increasing the athlete's physical fitness, because now they're not able to do something that is very violent. You think about arm action and everything that's happening in the trunk in a sprint, and the load and the forces that are going through those muscles. And now you've just removed all that because now they can't sprint anymore. Well, what are you replacing it with? And so you got to do something. And it's not ideal all the time, but we're not suggesting that you're going to do this hypertrophy circuit all the time, but it does have a use, right? And I think to that point as well, people that are interested in jumping high and running fast, they think that you need to only jump high and run fast, and that the weight room is less useful. But when we look at like tendon related research, we know that histologically, tendon morphology doesn't change with doing plyometric training. It maybe changes very, very, very little, teeny tiny bit that you can get from plyometric related training in the tendon. But we know heavy resistance training and even like maximal isometric training that will have massive amounts of tendon stiffness changes. And so it does have a place. Lifting weights and moving loads that are not the exact same way or in the same speeds that you do with your track and field training is important. And I recently posted about this, that like only doing exercises that look exactly like your sport or feel like your sport. And the analogy I used was it's like trying to train for a marathon by only running marathons. Like no marathon athlete or high level endurance athlete would suggest that that's a great idea. And so sometimes I think athletes that are, maybe, and I don't mean to pick on anyone, but track and field and maybe basketball as well is sometimes this way where they want to do things in the weight room that are only explosive movements and only moving weight really fast and only in ranges of motion that look exactly like the ranges of motion that they get into with their sport. And there's a time for specificity where we're peeling off some of the intensity and some of the volume in the weight room because we're trying to peak for certain competitions and whatnot. But the purpose of training and the purpose of strength training in particular is to build up resiliency in tissues that you don't get anywhere else in your training. It's a small piece of the grand scheme of the puzzle that's happening. And maybe perhaps you have strength coaches track coaches or sport coaches in general that push against the weight room a little bit hard because sometimes they may feel that they're being attacked or encroached on, that athletes want to make, too many efforts or spend too much time in the weight room. So they feel attacked or feel that they need to push hard against the weight room. And I think strength coaches also probably push really hard because they're going to be biased and think the strength training is amazing and it does all these magical things, which strength training is good, but it's probably not like this wild magic that some strength coaches think it is. And so I think there can be a blend and a nice balanced method where it does work between the two things. It doesn't have to be all one way or all another. I think there's a lot of complexity and nuance in being able to know the athlete well, know their training history, know what kind of things that they respond to, and having conversations about both the external as well as their internal load is important as we go across this rehab continuum.
Nice, nice. So, I think my last question for you is, So nowadays, like GPS data is
Hmm.
huge on load management. It's huge on return to play. So for maybe not just hamstring injury or overall injury, return to play, like what are some like different metrics you're gonna track for return to play athlete compared to like just normal healthy athletes?
Yeah, so that's a good question. And we talk about load management. I think sometimes it gets maybe a little bit overblown where, people feel that there's some magical number that is just going to be way too much for anyone. And that's probably not true. It's probably varied by training history, by age, by gender, all these things, right? That's going to alter, um, what you're able to do and how much volume someone's going to be able to tolerate. There was a really good, there's a paper, it's called Sprinting, a Potential Vaccine for Hamstring Injury. And a lot of people may be familiar with that because people talk about sprinting as a vaccine, right? But some of this data that we have about GPS related data is that total high speed distances are not associated with hamstring injury. So when we look at like these big collections of GPS data across lots of different sports, thousands and thousands of athletes, it doesn't seem that total amount of high speed yardages is important. What is important is spikes in high speed yardages. So if there was a good paper done in Premier Soccer League players as well that suggested that, or that I shouldn't say suggest, but what they found was that athletes that had not had a match in the previous 5 to 7 days and also had not hit close to max velocity in those previous 5 to 7 days were far more likely to have a hamstring strain in their next match where they did reach more max velocity. So when we talk about load management, it's probably not some magical cap where load now needs to be managed. It's more of managing the chronic workload over time that again, going back to the idea we started with, you're either prepared or you're underprepared for the load that you mean to do. And so running at max velocity is not something that is just innately or inherently dangerous or risky, but doing more max velocity work than what you're accustomed to or tolerated to can be. And so I think we can do this, and there's some smart ways that we can program it and build somebody up over time, but it shouldn't be one of those things that we're totally avoiding altogether. And so with that being said, like with metrics and things like that, lucky for us, at a university setting and Division I football, a lot of the guys do wear GPS units. I think we have 60 plus GPS units that go onto the field each day. And so we also have by position group, as well as data for maybe the individual athlete who did get injured. We know in a typical week or in a typical game how many high speed yards they're getting. We also know how many XLs, how many decels they're getting. We also know the total number of yards that these guys will get by position. We also may know their max velocity numbers that are hit during a game or during training sessions, based on the data that we've gathered over the previous 6 months to a year on this athlete who's been wearing this GPS vest, or at least we have if an athlete wasn't wearing it, we may have 5 to 7 other athletes that are in a similar position group that we can say, yeah, on average, this position typically gets this many high speed yardages. They typically hit this speed. They typically have this many XLs and decels, and they need to be able to tolerate a total amount of yards around this bandwidth. So that gives us a very clear perspective of, okay, if I'm going to say that this wide receiver, for example, is cleared to play, I know the standard of measurements and yardages that I need to be hitting in my training and possibly even exceeding it slightly before I'm giving the full green check mark on this guy going back and feeling confident to play. And, that maybe happens a little bit less in the college setting where it seems that sometimes there's a little bit more uh, pressure or risk to be taken in getting guys to return to play, and so we don't always get to the end before the sport coaches demand that the athlete returns, and that's very frustrating. But I do know that in the NFL, A lot of teams are very particular with that, and they will not allow the athlete to return until they've hit these metrics. Partially because you have a lot more money and the athlete's contract that is on the line. There's a lot more athlete protection in the professional league than there is for the college league. But we do the best we can to get as close as we can to those numbers and instill a lot of confidence in the athlete prior to going. Because here's something else that's really interesting that one of the two, or I should just say, two of the most predictive markers of return to play, or the most predictive things that can be done, is the athlete's subjective feedback of when they feel like they're going to return to play and the clinician's feedback of when they feel like they're going to return to play. Very interesting, but those are one of the highest indicators of when the athlete will actually return to play is their what they think will happen and what their clinician or the person that's closest to them thinks will happen have a very impactful, lasting effect on what actually takes place during rehabilitation. And so I say confidence in the athlete because I do feel like that's important to help them feel that they've managed rehab well and that they're going to dominate when they step back on the field and making sure that they feel the same because that will probably bode well for them.
Nice, nice. I like it. I like it. So I think that's all the question I have for you today. So for those who are interested in what we're talking about today, and you put up a lot of great content for those who are interested in like no matter like speed, rehab, where can they find you?
Yeah, thanks. You can find me on Instagram primarily. I'm very active there. And Coach Q Physio. It's Coach underscore Q underscore Physio on Instagram. And if you are interested in something like a very particular hamstring protocol, I have the little link tree link in my bio, and you can find the hamstring return to play protocol that comes with all the tests that you should be doing or looking at to guide your phase and rehab experience. And it gives you an outline of the workouts that you would do from both the weight room as well as the running and kind of gives you a framework to work within there. And I'll also be coming out with stuff like a groin strain one and similar things here in the future. But yeah, find me on Instagram, Coach Q Physio.
Nice, nice.